Okay, so it's recording right now, right there, and then we'll just go on with the lesson, okay? All right, so remember last time we were talking about how people stay healthy? They don't smoke, they don't, or they eat
Drugs?
healthy, they eat salad. Like you were telling me, you eat oatmeal.
I like oatmeal.
You like oatmeal. I have oatmeal with me today. It makes me feel good because it's hot. Oatmeal, when I eat it, I feel good, better. You work out? You're telling me you work out? No, you don't?
What is
Oh, all of the above? That means you do all three of these things. You don't smoke, you eat right, and you work out. You don't lift weights at your gym?
Oh, yes.
Yeah. So you work out.
Oh.
Lifting weights, running?
No running.
No running.
Walking.
Walking is good too. Walking's really good.
Swimming.
Swimming's awesome. I love swimming. So does your apartment have a pool?
Yes, I have.
Cool. I forgot that. It's awesome. We have a pool at our apartment, but there's always a bunch of kids everywhere. So now we talked about staying healthy, but when you get sick, there's a lot of different reasons. Sometimes you have an allergy.
No, I don't have allergies.
You don't have allergies.
Little for pollen.
A little bit of you have pollen.
Yes.
You're allergic to pollen.
Yes.
Sometimes people get sick. They catch something like a cold. And I want to show you and talk about. Let's see where to go. Well, we go to the doctor whenever we don't feel good. Like when we have a cold, when we have an allergy. If your allergies were worse, and would you be sneezing?
Yeah, for flowers, pollen.
What else happens? Does your eyes get itchy?
Right.
Your nose runs?
Yes.
So if it was really bad, it stopped up?
Yeah.
So if it was really bad, the doctor would actually give you a shot or give you medicine.
Medicine. I have medicine for allergies.
Okay.
In my apartment.
Well, I have a cold, and I haven't seen the doctor yet, so I have to take my medicine from a store. You have a store close by your apartment, right? What is it called again? What's the store called? Do you remember? Is it Walgreens, CVS? A drugstore.
The store?
Yeah, a little store. CVS?
GPS?
That's the store. That's the place you go to for your doctor's appointments.
Walmart?
You go to Walmart, that's right, because they have a pharmacy to get your medicine. Well, you know that you can buy some medicine without seeing a doctor. You can buy the pain medicine you were taking. You just bought that in the store, right? So I brought my medicine today. We're just going to look at some of it, okay? So we're going to talk about this for a little bit.
For eyes?
It is, yeah, it's eye drops. So, a lot of times, people take certain medicines when they don't have time to see the doctor. Have you used this before? How do you use it? Do you remember? Where do you put it though?
In my nose.
In your nose?
Little.
Right here?
Yes,
right
yes.
here? What does it do? Oh, it clears it up.
Yes.
The Vicks Vapor Rub?
Yes. I have in my apartment.
I used to hate this stuff. I used to hate it.
I know. Yes.
Yeah, it's to help you breathe better. You put it. My mom used to put it on my chest. Because I didn't like it on my nose. It burnt my nose.
It's good.
Yeah, I used it this morning.
For massage. What is it?
It's good for, let's see.
Massage.
Massage? For breathing?
Yeah.
And clearing up your lungs. Okay. Yeah, no, that's true. My boyfriend loves this stuff. He loves it. He puts it on his chest, put it on his nose. I'm just like, stay away from me. I don't like the way it smells. But I use it when I'm sick. These I got from the doctor when I was sick last time.
Mm-hmm.
These are cough drops. And when you get a medicine from a doctor, there's
Mm-hmm.
instructions.
Yeah. One
When,
cuts with every 8 hours.
mm-hmm, as needed. So I took this morning.
Mm-hmm.
8 hours from now, if I'm still coughing bad, I can take it again. Now, do you remember have you ever taken medicine that was given to you by a doctor like this?
Yeah.
What happens? Did you ever take too much of it or not enough? Did you take too much one time?
One pill for 6 hours.
What if you had taken 2 pills?
Mm-hmm.
Does it make you sick?
From
For your back?
Yeah.
Because you had back pain, right?
Yes.
Did that back medicine help at all? It did?
Yeah.
You got it from the doctor?
No.
Oh, okay. What about that? So if your eyes are really red from your pollen allergy, you could take which one of these?
Allergy?
Mm-hmm. Like let's say your allergy.
I don't remember the name.
Well, what would you take a capsule? Would you take one of these?
Yes.
You take a capsule?
Yeah.
Oh, when my allergies get bad and the pollen and I put eye drops in my eyes.
Oh.
Yeah, to make them not red anymore. And these are pain capsules too. I took this this morning for my headache because I had a really bad
What
headache.
is for your fever?
Let's see. This is also for fever too. Let's see. So the instructions are really, really, really tiny because doctors want to make you work for it. It's supposed to be for pain and for pain relief and temporary leaves. Yeah, and it reduces your fever too. So you could take that if you wanted to make your fever go down.
Mm-hmm.
And then, have you ever seen this stuff? Airborne. So some people take this stuff. It's vitamin C. You put it in your drink, like water, and it's supposed to make your body a little bit, your immune system better, so you don't get as sick. Now, I don't know if it actually works because I still get sick even though I take these. But they taste. It's made from oranges. It has vitamin C in it.
Mm-hmm.
Vitamin C. Have you heard of what that does for your body? Vitamin C.
Vitamin.
Mm-hmm. Oh, sorry, throat hurts. So I have a sore throat, and I have a cough, and my nose is running, and my head hurts. What do you think I have? Do you think I have? And my ears are aching. My ears and jaw, all pain. Mucho más duele.
¿Duele?
Mm-hmm. Aquí, y aquí. What do you think I have? Do you think I have? Do you think I have hearing loss?
I don't know.
Hearing loss. So hearing, you hear with your ears. If your ears get infected or they get hurt, you can't hear anymore.
Mm.
You have hearing loss. Okay. Speak louder. Yeah, speak louder. I can't hear you. Because, yeah, if you get sick.
Problems.
Mm-hmm, you get an ear infection.
I know.
I used to get ear infections when I was little all the time. Because I would swim. We would swim all the time.
Oh,
Mm-hmm.
water?
Uh-huh, and water. And I would just be like, and I would be in bed all day. Just, yeah, I get ear infections. And it would hurt. But you never got any? You never got any? Well, that's good. They're not fun. Not fun. So I have a headache. My eyes are hurting. My ears hurt. My jaw. My throat. Do you think I have vision problems?
No.
No. I mean, I'm wearing glasses. If I didn't have these on, we'd have problems. I can't see without these.
Mm.
but I have glasses. What about depression?
Little,
Yeah, pretty miserable. Do you know what? So, can you use depression in a sentence for me? Just a little bit. Depression.
for my family.
Oh, okay. Let me see if I can. My family too. Some on my dad's side, they have a lot of issues with that. They have a lot of issues with depression. They take medicine. Depression, manic depression. No, not fun. Manic depression, you're okay, and then and you're okay for a while. But if you take medicine, it helps. Certain medicines for your head.
No,
No, it doesn't help. You don't think so?
it's normal. Little.
It's normal.
No,
Yeah, no,
no.
it is. No, you're right.
No, no.
You can't be happy all the time.
Yeah.
Yeah.
No.
Hey, sometimes it's good. It's okay to not feel good all the time.
I miss you, my family.
Mhm.
It's not. It's a depression.
Mm,
It's little.
a little bit.
Yeah.
You know, you can't. In the thing, yeah, you can't be happy all the time. You know,
Mhm.
it's hard.
I'm happy.
Yeah. Yeah. No, that makes sense. So, have you? You said you have grandparents.
Mhm.
Grandparents. Do they have hearing aids in their ear? No. Do you know what What it is? Hearing aid.
Mhm.
Ah, I can't hear you. What? What?
No.
The hearing aid goes in your ear.
Mm-mm.
Oh, they don't have it. My grandparents had it. He had it right here. What? Oh, okay.
Yeah.
All right. Yeah.
More maximum volume.
Maximum volume. Come on, you know. A little kid. What are you doing? Ah, talk quieter. So this is. Can you say that for me?
Therapy.
Therapy. So there are two different kinds of therapy. There's physical therapy, and then there's mental therapy. That's where you can talk to somebody. Psychology, yeah. It's a branch of the mental therapy.
Mm-hmm.
So with physical therapy, people who have been in accidents,
Mm-hmm.
who have had diseases that they have to work out, or their body they need to work out, move their legs, their arms.
Mm-hmm.
They have people that help them. They're physical therapists.
Mm-hmm.
My aunt is one. My aunt is a physical therapist.
Mm-hmm.
Yeah, she makes good money. Dia, can you take me to lunch? Dia,
Yeah.
I know you have money. She has a Mustang.
Mm-hmm.
Mustang, oh, it's a beautiful car. She bought it with her money.
Mm-hmm.
But yeah, she loves it. She loves it. But mental therapy, psychologists, therapists, counselors. We have some at this school at UTA. If you wanted to, you could go talk to a counselor or a therapist. If you just wanted to talk to someone, they are here to listen to you. And if you have problems, if you had depression that wouldn't go away and it got worse and worse, you would go to a therapist to talk about it. And they actually might prescribe you something, a medicine for your mind. Does that make sense at all, Kyle?
Yeah.
Yeah. So psychologists do the same thing. They help you with your mind. Like if you had problems and you didn't know how to fix them, they could help you with that. So, but my problem isn't mental, or really, it's physical. Yeah, my ears hurt, my throat hurts, I cough. I didn't mean to actually cough that time. My head hurts. So, I don't have any of these. This is not my problem. I think I might have, if I can find it. Oh, God, yeah, I should do this. I think I have a cold. Yeah, because I didn't do these things on this list.
Mm-hmm.
I tried getting rest Wednesday, but I need more. I need more rest. I didn't get my shots. I need to drink a lot of fluids, and I need to take medicine. So, you said that I should go home and get some rest, yeah?
Mm-hmm.
What would you do if you were sick?
Hmm?
What would you do if you were sick?
What is it?
If you were sick like me, what would you do? Would you rest? Would you take medicine?
For my backpack?
For your body. Tu cuerpo.
That's good.
Pero, what if? See? What if? What if you got sick? What if you had to take this medicine? Would you go to the doctor first?
Yeah.
Probably should go to the doctor.
Sometimes not see me.
Oh, sometimes the doctor doesn't see you?
No.
Does a nurse?
I am health.
You're healthy.
Yes. Little on my back.
But
no more.
let's say you did get sick though. What if you were sick? You had a cold.
I go to doctor.
You go to the doctor first?
Yeah.
Oh, okay. But what if he couldn't see you that day? What if he couldn't see you yet tomorrow?
Tomorrow?
What if he couldn't see you for a while, for a couple of days? What would you do?
Go to pharmacy.
Go to pharmacy and get medicine?
Yeah.
Would you still go to work?
Hmm?
Would you go to work still? Yeah.
Yeah.
Even if you're coughing?
Yeah. I don't like it.
No, not coughing. Coughing.
No, okay.
What if you're coughing everywhere at work? I wonder if they would make you go home. Go home, Kyle. We don't want you coughing here.
Good.
It's good. I mean, that would be nice getting a break, huh?
Vacation.
Yeah. A vacation would be great. That would be nice. So I wanted to try to go through a few of these over here. So what I was talking about with this Tylenol, you could go to CVS, Walmart. Go into Walmart, and then you could buy this without going to see the doctor or the pharmacist. It's called over-the-counter medication because you don't need to go to the counter. It's on the shelf, and you just grab it. This is talking about the pharmacist and all the medicine behind him. You'd have to go to him to get this medicine. Does that make sense? So if that's true, which one of these is over the counter? Which one of these medicines is over the counter? This one because the doctor gave it? Okay, that's a good one. The doctor gave it because he wrote a prescription.
You need appointment.
You need an appointment to get this medicine.
Yeah.
Last semester I
I'm not gonna need appointment.
Oh, really? Just come in?
Pharmacy and then whatever medicine.
Whatever medicine you need, they'll just give it to you?
Yeah.
What do you see the doctor for in Mexico? What did you ever have to see the doctor for besides your accident?
Yeah.
That was it?
Huh?
Did you ever see the doctor in Mexico for...
You just serious?
Right, your surgeries. Did you ever get sick? No, you never got sick. Never got sick. Lucky, you never got an earache. You never got sick. You only have allergies. A little.
In Mexico, no.
And
Here,
Mexico. Oh, Mexico, you didn't have allergies.
No. Mexico, no.
Okay, I got it. So in Mexico, you didn't have any allergies.
I want the one mosquito.
Mosquito.
The pig.
Mm-hmm. Really?
What is the name?
Malaria? No.
What is the name? Dengue.
Dengue fever?
Yes.
You had dengue fever? Whoa. What did that do?
3 days, 2 days.
You had 4 days.
Yes.
What were your symptoms? Did you cough? Did you have earache?
Fever.
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 Did you have anything else besides a fever?
Fever.
And you slept a lot.
Yes.
Wow. People are really scared of dengue fever.
Sleep.
Just sleep? That sounds nice.
Yes.
No. Wait, so were you dizzy?
You see? Yes.
Oh, you were.
For mosquito.
Mm. Yeah, people are scared of mosquito bites because of that. They get dengue fever. There's the Zika virus.
Zika,
Yeah.
yes.
People are really worried about that one.
More people
Are getting sick?
Zika. No.
No good. Are they dying?
Finish.
They're dead.
Finish your life.
Oh, goodness.
Later. Mosquitoes.
I don't like mosquitoes.
I'm
I'm allergic to mosquito bites. Oh yeah. Yeah, I don't like
in
going
my apartment, I
outside.
don't have mosquitoes.
That's nice.
I don't have any mosquitoes.
That's good. When the winter comes, the mosquitoes will. Whenever there's a winter
Do you have
comes.
mosquitoes?
Sometimes I stay out there long enough. They bite me and the
Just
bite
leave.
swells. Ugh, I hate it.
What the fuck?
They bite and the bite swells really big, like this big.
Hmm.
It's red. It itches. Let's see. I have all these bites from when I was little still on my leg. I know. I hate mosquitoes. I hate them. The worst part about and the heat. But when the winter comes, they'll kill mosquitoes because it's so cold.
Mm-hmm.
Have you, in Mexico, is it cold? Does it get really cold in the winter? Similar? Okay. It won't be too bad here. It doesn't really get that cold for very long.
Mm-hmm.
The coldest this month is January.
School?
Mm-hmm. Coldest. December is kind of cold. Sort of cold. January is the coldest month. Coldest, do you know?
Mm-hmm.
Yeah?
No.
No good, yeah. Sometimes it snows. Sometimes it snows in January here.
Go to Mexico.
Go to Mexico?
Yes.
Does it snow there?
Maybe 2 months. Vacation.
I should. I should go there for a vacation. That'd be fun. I want to go to Monterrey. Monterrey?
Monterrey?
Mm-hmm, Monterrey.
You go to Monterrey?
My cousin is going to buy a house there
Mm.
in Monterrey.
Monterrey.
Monterrey? Can't say it. Can't say it right. But he's going to I think he's going to get a house there. And so it'd be a house everybody can come visit.
Mm-hmm.
Be nice. Oh, nice. I hear it's really nice there. Is it? Have you been? I know.
Monterrey?
Mm-hmm.
I don't know.
You don't know?
No. Never.
Are you gonna stay here? This is the one with the rest of people. Thank you so much.
Yeah. Oh, sorry.
Okay.
So, I know we got a little off topic, but talking about medications, talking about the pharmacist that you have to go see to get your medicine here. You have to go to the doctor to get prescribed medicine. And you have a nurse that takes your blood pressure, checks everything. Did you remember seeing a nurse when you went to the doctor's office?
Doctor office?
Mm-hmm. When you went to JPS?
Yeah.
You saw a doctor? Did you see a nurse?
Mm-hmm.
A woman who took your blood pressure?
Yes.
Yeah. Okay, so sometimes when you go to the doctor, you only see a nurse. When you go here. Sometimes when I went to JPS when I was younger, I would only just see the nurse maybe, and not the doctor. But I would still get my prescription. And so I wanted to see if you could help me figure out this what's wrong with each of these people in this picture and see if you can find what's wrong with them.
He has a cold.
He has a cold. Yeah, it looks just like me. Can you read it out loud?
He has a fever.
My eyes are watering and I keep sneezing. What is wrong with me? Oh, okay. So, watering and sneezing. What? Which one? Say it one more time.
His neck is left.
Remember when you
He have fever.
hay fever? Okay, we were talking about allergies. When you talked about you sneeze a lot,
Yeah.
pollen.
Yeah.
That's hay fever. If it was
One
really
day
bad.
you go to Garden Botanic.
You did? Oh, that must have been awful. Oh.
It's beautiful.
It's very beautiful. Did you go with your family?
Finish.
You're done.
Oh.
Go in the winter. Well, it's not pretty in the winter. What about this? Oh my goodness. When you got into a fight. Okay, so can you read?
Have you allergy, maybe?
Well, why don't you read? Well, let's read this. Let's read this. A patch of my skin is purple and sore. So, see, he has a. Do you know what this is called? Black eye? Hey. You said when you were younger, did you used to fight sometimes?
Mean.
No, you never got a black eye. Did you give black? You gave black eyes.
Yeah.
All right. So.
I am my very big for.
You were small? Were you small?
Maybe.
Or were you tall?
Tall.
Oh,
Yes.
yeah.
My cousins.
I'm tall too. Yeah.
My cousins.
They're shorter than you.
What's up, man?
So, did you ever get punched in the arm like a friend? Like, hey, did it ever hurt?
Yeah.
Did you ever lift your shirt up and it was
Yes.
dark?
It's purple.
So you know what that would be called? It's a bruise. A bruise. Whenever your friends, cousins, hey. I used to play that with my cousins too, my friends. I had a bunch of guy friends, and I was like, hey, and they'd be like, hey, ah.
I have a bruise.
I have a bruise. Yeah, he got beat up. So this guy, let's see. So he has a headache. And a
sore throat. What should he do?
I'm good. We're gonna record for about 30 minutes, but doing it right. Hanging in
Okay.
there.
If you, do you think you're going to need to go early?
I'm doing good so far. On some medications.
What I'm at least going to do is see if I can find somebody to come cover the lab from 2 to 3, and then if you need to go at 2, if you can at least make it that far, then
that'd be good.
Will that
That'd
be
be
okay?
great. Yes,
Okay.
thank you.
Kyle already told me he doesn't mind getting out of class early today.
Okay, all right. Thank you,
I'll
Cindy.
see what I can do.
Okay. So Jack has a headache and a sore throat. This sounds familiar. Okay. What should he do? What do you think? What do you think I should do? You told me earlier because I have a headache and I have a sore throat. What would you tell me? Kyle, I have a sore throat and my head hurts. I have a headache.
You have cold?
Well, what should I do to feel better? You told me earlier, remember? You told me, Renee, you should go home and rest. So Kyle, my throat hurts and I have a headache. What should I do?
Go to my house?
Go home?
No.
Should I take any of this medication?
Go to the doctor?
Go to the doctor. That's great. I should go to the doctor. If it lasts one more day, I will.
Yeah.
The doctor's not open on weekends. So, see him on Monday. Okay. So, I should take some medication, maybe some pain medication, and rest.
Yeah.
Rest. Yeah.
Yes.
Because sleep's important, isn't it?
Yeah.
Yeah. You were telling me when you
It's
had
not good for health.
dengue fever. You
Yes.
slept.
Sleep every day.
4 days.
4 days. I go to eat. No, eat little. No, no appetite.
No appetite. Oh, I
No.
heard. Yeah. Couldn't eat anything.
Yes.
When I was little, I had a stomach virus, stomach flu. I couldn't eat anything. I just throw up.
Mm-hmm.
I got sick of my grandparents,
Mm.
and yeah, it wasn't good. It was not fun. Because there was a bunch of people living in the house at the time.
Mm-hmm.
Cousins, uncles, aunts. And there was only 2 bathrooms, and I was like, open the door. So I was getting sick. I had to throw up, and they were like, I'm in the bathroom right now. They wouldn't open the door, and so I ran outside. Blood all over, all over me. And I was wearing my grandpa's shirt because I threw up all over my clothes. And my cousin came out. Hey, she's throwing up. She just pointed. She was like, she's throwing up everywhere. My older cousin. I had to clean. My grandma, she got the hose, the water hose, for the plants, and she sprayed me down. She sprayed me down with a water hose. Yeah. That's crazy. Yeah. Well, it was when I was a kid. I never wore my shoes anywhere. I never wore shoes outside, and that's another way you can get sick. So it rains. We play outside with our shoes on all day. I got sick a lot. But I think you actually understand all this stuff pretty well. Would you be able to tell me can you read this? This right here. And can you read it out loud?
Take two capsules.
Mm-hmm.
Why? For 3 times a day for stomach pain.
So, Maria got this from her doctor.
Mm-hmm.
How many capsules does she take in one day?
3.
3?
No, 2.
2.
3 times.
3 times a
2
day.
capsules.
So 2 capsules 3 times a day.
Yes. 6 for day.
So she takes 6 in one day. And she has to take it with food.
Mm-hmm.
There's some medicine that if you don't take with food, it makes you sicker. It makes you nauseous. And so you have to eat and then take your medicine.
Mm-hmm.
How many capsules does she take in 1 week?
42.
1 week? Yeah, okay, that's right.
Yeah.
I do math. I'm not good at math, so I have to do this. I have to write it out.
6.
Yeah, no,
6
you're
for
right. 6 times 7.
6 for 7.
Mhm.
Is
42.
42.
42 pills a week. Ugh,
No good.
not good.
For your stomach.
Mm-mm.
The medicine is good. It's good for little.
But not a
For your
lot.
stomach, no good.
Yeah, I agree. No, I agree. I think there's too much.
Yes.
Too much. If you take too much, it's not good for your body. Let's see, now where did I put the other? Oh, here's a good one. Okay. So, there's different people you go to see about different things that are wrong. If you were if your body was hurting and you had a cold like me, you would see a doctor, right?
Mm-hmm.
If you had something wrong with your head, or if you wanted to talk to somebody about depression, you talk to a therapist or a psychologist. So we're just going to see what some of these other ones are. A psychiatrist, as a doctor for depression and stress. pediatrician. Okay. It's a long word, right? Can you say it?
Pediatrician.
Pediatrician. So a pediatrician is a doctor that's only for children and babies.
Just for babies.
Yeah, you take your son, you took your daughter to pediatrician.
Yes.
Okay, so a cardiologist.
For her.
Yeah, it's for your heart. An obstetrician. Now, you probably won't know this one. That's for pregnant women. Your wife went to go see an obstetrician. She would know. She'd go, oh, yeah, obstetrician. Pregnant women go to see obstetrician to make sure the baby's healthy and everything's going good in case she has complications. And then a nurse, you've seen a nurse before. They help the doctor. My aunt is, she works with nurses. My aunt works with nurses in a hospital. She is gonna be, yeah. But this person actually helps patients and doctors. Yeah, I guess so. Nurse, patients, and doctors. They assist the doctor.
Yeah.
And they deal with patients a lot. Yeah. So, Dr. Aziz is a pediatrician. Do you remember what we talked about pediatricians for?
For babies.
For babies. Tanya is a nursing assistant. So she's an assistant to an assistant. She would be an intern. That should be. I think she's just a nurse, a nursing assistant. There's a lot of people in the hospital that are interns. That means that they work in the hospital and they're learning to be a nurse or they're learning to be a doctor. They don't get paid anything. Like, I'm an intern here. I don't get paid. Okay. Dr. Kumar is a cardiologist. You remember, you told me you know exactly what that is. A cardiologist? What does a cardiologist do?
For her?
Yeah, for your heart.
Yes,
Yeah.
For more exercising. One day you go to cardiologist.
That's good.
For go to exercise. And I need to.
Yeah.
My hair is bad.
Your heart's bad. Your heart is weak.
Yes.
Be careful with it.
Your hair is good. Maybe for.
For lifting weights, it's good
Yes.
because you can go at your own pace. You can go slow or fast. But if you ran, it'd be harder on your heart. Harder on your heart. So, Dr. Chen is an obstetrician. What were you talking about? You got it, obstetricians for... This is the one you didn't know. Your wife would know. She had to see an obstetrician when she was pregnant. So it's a doctor only for pregnant women. So that would be the obstetrician, I think. Yeah. And the pediatrician is just for babies.
It's for
Babies and little kids.
Yes.
And then the obstetrician is the one who checks the women when they're pregnant, make sure everything's okay. Sometimes they deliver the babies too. I can't remember. Yeah, sometimes they deliver the babies in the hospital. And then the pediatrician sees them when they're 1 month old, 2 months old, 3, 6 years old. But I think you got these down pretty good. Do you have any questions? No? You sure? All right. We're just going to cover some of these, not all of them, okay? Just some.
No good.
No good. The needles are not good. What else do you recognize in here? Can you tell me the names of some of these? Doesn't have to be all of them, just the ones that you know. Why don't you look at the pictures and just look at them and see if you recognize anything. Like, can you tell me what you would use this for? Yeah, that right there. Kyle, I'm gonna cut some vegetables. Oh, I'm distracted. Ah! Kyle, I need a Band-Aid. I need a Band-Aid for my cut. Yeah, Band-Aid. They go wrapped around your finger. My mom broke that one. Okay, she broke that right there. Okay. We talked about this the other day. Whenever you go to the hospital, when you were in surgery, you came out and they had a bag hanging above you. It was full of fluid. It was an IV bag. Let's see if it has IV bag. It probably got cut off. If you could write IV bag right here. IV. Yeah. IV. It's an IV bag. Do you know what this is? Can you explain what it is to me?
It's maybe water king.
Well, what's inside of it? What's inside of this?
Emergency.
If it's for emergencies.
Yeah.
It's for emergencies in case you get sick at work. Do you have this at work?
Maybe.
I mean, it's good that you should find out. So you work with meat. You're cutting meat, and someone says, "Hey, Kyle," and you look while you're still cutting.
Let's do a doctor. Emergency.
Right, but you have to wrap your hand up, right? If you cut it, you have to wrap it up in something. Inside of here are Band-Aids, antiseptic for your wound.
Yeah.
It could burns.
You
Oh.
my job? No, exactly nothing. Here
Oh, okay.
and a little.
A little bit, a little cut.
And the mix.
Yeah, but what if it was your whole finger? What if it was like?
Yeah.
What if it was?
It's the 2 weekends. No.
What if it was right here? What if that happened? What if your finger got cut off? So you wouldn't go to the first aid kit, open it, get a Band-Aid out, wrap it. That's what you have to do for emergencies. Find out where that is in your work, because you work with sharp objects. I'm really clumsy. I wouldn't be able to work in your job without having an accident. I walk. So I think. What about this one? You use this every day, right?
String.
Yes.
Cream.
Cream. Yeah. Ointment. Ointment's there's ointment, cream, same thing. But you use this for rashes. And you talked about not liking this. Well, that's a suitor. That's not this one. This is, you're getting injected with something, right? The syringe.
Injection.
Yes, injection. A suitor. So when you had your accident, the doctors went in But when they closed your leg back up, they sewed you up, didn't they? That's a suitor. Those suitors. I'm sorry to bring back bad memories. I had suitors on my knee right here. You can't see them, but they're like right. Suitors. Those are because they had to take those back out, right? They had to come. You had to come back to the doctor. Did you have to get them removed?
Mm-hmm. Oh. It's slow. Here. Slow.
Did your stitches? Oh yeah, I see. That's what my scar kind of looks like a little bit.
This is for different.
Different? That was a different. That's from something else.
It's for. Scaling.
You were rock climbing. You were scaling. You were climbing up something. You fell.
Yes.
So you were rock climbing.
Yes.
Then, and you fell. Oh. What? You're crazy.
A little crazy.
You're a little crazy.
Yes. I like the adrenaline. I like the
Adrenaline? You like the adrenaline? Oh. You probably like skydiving.
Adrenaline.
Ugh.
I like that. I like velocity. Velocity?
Mm-mm. What? Why don't you try explaining that? Racing.
Velocity.
Racing, car racing.
It's not like the mountains there.
No.
The Six Flags.
Oh, roller coasters. You don't like roller coasters. That's kind of funny that you don't like those. But you like. Okay. I can do roller coasters, but I have to close my eyes. I have to close my eyes. And then, if I open them, yeah. But if I open my eyes, open my eyes.
One day you go to this place,
No, you didn't like it. Well, okay. That's pretty funny though. I just don't understand how you don't like Six Flags roller coasters. You don't like roller coasters, but you love rock climbing and adrenaline. It's very strange, but I think this has been a good session. Thank you, Kyle. I hope this helps.